This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and I'm delighted to welcome to the program today Mayuri Chaudhari, who is from the Public Health, Grey Bruce, and we're going to be discussing some important information regarding vaccines, and especially around COVID-19, seasonal flu, and school-mandated vaccines. So there's an awful lot of information, I'm sure, packed into this segment. Thank you for joining me today. And maybe you could just tell us a little bit about how long you've been and what your role is with the health unit before we start on the questions.
Sure. Thank you for the wonderful introduction. So I'm Mayuri. I'm the manager of the Vaccine Preventable Disease team at Grey Bruce Public Health. So I've recently started here. Before I was working at another health unit, also on the vaccine team. So I was a frontline nurse at that time, and now I'm working as the manager for vaccines.
Wow. So that would be a change, I'm sure. Good for you. Good for you. So I know school has just started. So the information you have about school vaccines is really, really timely. Now, I understand that there's a School Pupils Act. And can you tell us a little bit about what it is and what the mandate of it is?
Sure. So it's called the Immunization of School Pupils Act, and it requires children from JK to grade 12 to be vaccinated against specific diseases. Now, the vaccines for these diseases are publicly funded, and there's other vaccines that are publicly funded that aren't required, but they're recommended, and we do offer them to students. So all children from JK to grade 12 are required to be vaccinated against those specific diseases unless they have a valid exemption. So it could be a medical or a non-medical exemption that they have in place.
Can you tell me what the diseases are that actually are the ones that they have to be considered to be vaccinated for?
Sure. Let me just pull up our.
I can go to the next question if you like, but I'm just interested because we're hearing. I mean, a few years ago we didn't know about COVID, so I'm just wondering if they are the same as when my children were growing up, or if there's been any change at all.
So there is a list of about 9 diseases, and they've stayed the same since before COVID. This act was implemented a long time ago, and those have all stayed the same. So COVID hasn't been added to this list. So nothing's changed from before the pandemic on the list.
That's really, really helpful. So you mentioned that there are exemptions. And so how does the school or how does the health unit deal with those exemptions? The children still go to school if they are exempted. Is there a letter that's required or?
Yes, so for an exemption, the parent would connect with public health and we would provide them with some materials talking about those specific diseases that they were wanting an exemption for their child for. So the exemption can be a medical exemption or non-medical one. And so the parents would fill out forms that aren't created by the local public health. It's a provincial form. So they would receive that information, they would go through the information, fill out those forms and submit them back to public health. And we would send them to the province. And then in that case, once that exemption is validated, then the child is able to go to school.
Right. Yeah. So I want to ask you the question about why parents should consider having their children vaccinated.
Yes, for sure. So these diseases can spread really easily, and some of them are deadly as well. And the vaccines do provide a really good protection against these diseases, especially in preventing them altogether. So that's why they're really important to get vaccinated against.
So obviously, the consequences could be serious, but it also means that the children are ill with it. Like they may not have the most serious, but and then is it possible to spread those diseases to other members of the household?
Yes, so the diseases that are mandatory do spread really easily. And so you can not only spread them to members of the household, but you can even spread them to other children who are not vaccinated against those diseases. Because they spread really easily, that's why they're more dangerous, and they have really severe symptoms as well. And that would be part of the reason why there is a mandate to really get vaccines against them, so we can prevent outbreaks for those diseases altogether.
One of the things, certainly from my experience, with children, is, of course, children being sick is never what any parent wants. But I found that it also impacted the parents' lives, because then someone had to stay home with the children if they were sick. And then the impact on your family life or grandparents, but obviously they're not always available. So the impact of children becoming sick through diseases like this that can be spread so easily has a much larger impact than just a child, correct?
Yes, exactly. Yes.
We need to think about all that. And after you've had to do that once or twice and stay home and call into your boss, then you say, oh, oh dear.
Yes, for sure.
Now, a child getting a vaccination, does that 100% guarantee they won't get sick?
So any vaccine does is it introduces that virus to your body in a non-harmful way. So your body actually then uses that to build natural immunity with it. So a vaccine can never provide 100% coverage rate, but they're really high, especially the vaccines that are in the ISPA, because they've been around for a really long time. They've been studied for a very long time. So they provide very high coverage rates.
Right. And when you say IPSA, you're really talking about the Immunization of School Pupils Act.
Yes, I'm talking about that act.
Yeah, it's okay to use the acronyms. I just need to make sure I understand what they mean.
For sure.
I remember that we used to be given a little yellow folded piece of paper that was a vaccination record. Is that still in place? And tell me a bit.
So people can use that. Newborns do get a record, but now due to technology, it's not something you have to keep around anymore. If you like to have a copy, that's wonderful. It's still considered a valid, record when you go to get your child immunized for the next vaccine, or if they need it for school or anything like that. But if you don't want to bother with that, you can get your child's record online. So you can go to our public health website. There's a link there. It'll ask for a little bit of information to identify the correct person. And you can get your child's record on there. And instead of carrying that yellow card, what you can do is every time you get a vaccine from your doctor, you can just update public health, and it will go automatically onto that online provincial database. So you don't have to carry the yellow card. But if you choose to, it's still considered a valid record.
Right. So whether children are vaccinated through their doctors or other ways, that can get collected centrally, but sometimes the parents have to send that up, or the doctor's offices?
So it's the parent's responsibility to make sure that their child's record or updates for their child's vaccination records are provided to public health. So sometimes doctors' offices do send us those records, but they're not required to. So for a parent, my best tip would be to say, whenever you get vaccinated at your doctor's, just you take a copy of that record and send it to public health, or maybe you can ask your family doctor if they're able to do that on your behalf, just so that information gets to us. If they're getting vaccinated at the school, then public health is vaccinating them, or if they're getting vaccinated at a public health clinic, then they don't have to do that because we would be documenting it when we're giving the vaccine. It's just when you go to your doctor's office.
Yeah. So that's really important to know, because I wasn't aware that it was the parent's responsibility. I made the assumption that the doctor's office took care of that, but you're saying parents need to be absolutely sure that that information gets shared. So that's really helpful to know. So children receiving vaccines, I mean, sometimes it's a challenge to convince a child to go in for a needle. Is there any advantage or disadvantage to having several injections for different things at one time?
So it's actually very safe to get all the doses that the child needs at a specific age all at the same time. And it's even recommended. So lots of studies have been done about anxiety because, children are anxious about getting vaccinated. So when you look at the level of anxiety, it's better for the child to get all the vaccines that they need at that age group in one visit, rather than taking them to the doctor's office multiple times a year for different needles. So it's perfectly safe, and it's even recommended to get all those doses at the same time.
So you're saying the side effects are not there. You're not overloading the child's immune system all at once.
No. So the nice thing about vaccines is, I guess, these side effects. So what you would experience after getting the vaccine are pretty similar for every single vaccine. So, vaccines mostly work the same way, and so how you feel after each vaccine is pretty similar. So when you get multiple vaccines at the same time, it doesn't make you feel a lot of different symptoms. If you got 3 in the same day, or if you got 1, you would probably feel the same afterwards.
Okay, that's really, really helpful. Just to mention a few things for parents who, it's a new experience for them to start this vaccination process. What sorts of things could they expect, or would you advise parents to be prepared for in advance, just in case?
Yes. So if you're taking your child for a vaccination, what really helps is to prepare them ahead of time. So maybe run them through the routine of what's going to happen when they go. And I think another thing that's really helpful is using breathing techniques for the child, or going through some coping mechanisms before you end up in the chair getting that vaccine, because at that time they're too anxious to listen to you. But if you've already practiced some coping mechanisms with the child, then you can remind them and say, hey, we talked about this breathing technique. This is a good time to use it. So that would be good. And then also, anytime you go to get vaccinated, first they will check your record to see what the child needs. And then spacing is important. So usually after any vaccine appointment is done, the nurse or physician, whoever's vaccinating, should tell you when to come back for the next doses.
Right, right.
So it's always good to ask that if someone didn't tell you.
Right, right. I've also seen sometimes where parents will actually have the children sit on their laps while they vaccinate. And I think that's such an amazing thing, to be actually that physical presence right then and there. And it's great that that's allowed to happen sometimes, which
Exactly.
Is there anything, before we move on to the COVID-19 and influenza vaccines, is there anything I haven't asked you about the children's vaccinations that you wanted to share?
I did just want to share that the different places that children can get vaccines for their routine vaccines. So, from infancy to about grade 6, your healthcare provider would be the best place to get your child vaccinated.
Mhm.
Um, for grade 7 and 8 children, we go into the schools to vaccinate them. So that would be the best place for them to get
Yeah,
vaccinated.
yeah,
For children in high school, a good place is their school. We try to do school clinics for them every year, and also their healthcare provider. And then, of course, for those that may not be able to get vaccinated at school for some reason, or maybe don't have a healthcare provider,
yeah.
or maybe can't get an appointment, we do have clinics at Public Health that you can contact us and book an appointment with us to make sure that your child doesn't miss any of the vaccines that they need.
Yeah, yeah.
Another thing I wanted to touch on was how parents can submit the record. So one of the tools that we have for parents to submit records is ICON. And so more information about that's available on our public health website. So you can go in there, you would just submit your record through there. You can also ask your healthcare provider if they're able to fax that record over to public health. You can also email your record to us if you're comfortable with that. And all of these methods and all of the information required for these methods are available on the public health website for those that are wanting to know how they can get their records to us.
Excellent. So let's move on to the next, and let's talk about COVID-19.
Sure.
So, what are the current recommendations around the COVID-19 vaccines?
So currently it's recommended for people to receive a booster dose this fall if it's been 6 months since their last COVID booster dose. Also, if someone hasn't started their primary series or is planning on completing their primary series, fall would be a great time to do that because this is the time where people are most at risk for respiratory diseases such as COVID-19 or flu.
I'm hearing the term vaccine fatigue, especially in relation to COVID-19.
Yeah.
And I'm wondering if you can emphasize why it's important for people to stay up to date on their COVID-19 vaccines.
Mm-hmm. Yes. So even though the pandemic is considered over, we're still seeing cases of COVID-19. And vaccines are our best protection against COVID-19 currently. So a booster dose this fall is expected to increase that protection against COVID-19 that would have waned since that last dose or the last time you had COVID, if it was 6 months ago or more. So, if you got a dose just a week ago, you're doing pretty good. But if it's been 6 months or more, that immunity would have waned. So it's good to get that booster and just top up your immunity a little bit. Also, vaccination of individuals at high risk will help reduce their risk of severe disease, potentially ending up in the hospital and even death, because there is still that risk with COVID-19, even though it's gone down significantly, it's not completely eliminated.
Mm-hmm.
And then vaccination of individuals who may be at a lower risk, it would help them, prevent getting sick and or even if they do get sick, the symptoms would be a lot less severe, so they wouldn't end up in the hospital. And it would also protect those that are really high risk around them. The more
Yeah.
people are vaccinated in the community, the more individuals who are at high risk are protected. And also the booster dose this fall will be formulated is formulated to target the most recent strains, because the strains of COVID-19 have changed. So they're changing the vaccine to stay up to date with that.
Yeah. And that's your point's well taken. People say, well, jeepers, I got all these shots. haven't they got it right? And what you're really saying is it's a process, it's evolving, it's a virus, and they do that. So great if people have had their vaccinations, but it doesn't stop there.
Yes, because the disease itself continues to change, and so we're trying to then make sure our vaccines are targeting the, I guess, modified version of the disease.
Right. I want to talk a little bit about flu. And I've been hearing about RSV, like the respiratory virus. Is that the same as flu or is it something else?
No, they're different, but they're both respiratory illnesses. So
Okay.
just like COVID, flu, RSV is also a respiratory disease, but they're different diseases, so they would have different vaccines
Yeah.
available for.
I must say, as we're moving into fall, it sounds like there's a triple threat to us. We used to hear about flu all the time. Now we've had COVID-19, and now we've got the RSV. So people it feels as if we're more at risk because of these viruses and that there's a changing trend. So can I get my flu shot, my RSV shot, and my COVID-19 shot all at once?
So with RSV, actually, it's a little different than flu. So flu and COVID, they pretty much target everybody the same, right? No matter what age you are, they're pretty much targeting the virus. Targets everyone about at the same rate. But RSV, generally individuals who are young and healthy are less at a less risk of that disease. So RSV is really more prominent in infants, and then those over 65 that might be immunocompromised or may have more comorbidities. So with RSV, actually, the province is not saying that everybody should be getting an RSV vaccine. So hopefully that helps some people reduce another shot on their list. But the ministry is still working on finalizing some details about who should be getting the RSV vaccine this fall. And so that won't be the general population. There will be some more specific criteria for that because it is more prominent in specific age groups and those that are immunocompromised, maybe.
That's helpful to know. It's a much more targeted strategy.
Yes.
Rather than all of the population. So if I go to get my flu shot and my COVID-19 shot, I can get those together, right?
Yes, you can get those together, and it's perfectly safe, and it's even recommended just to save you another trip to the pharmacy or the doctor's office. And just like I talked about the other vaccines, the way you would feel after getting both of those vaccines is pretty similar. So you can get them both at the same time, and they work well together.
Yeah, good. So that information then is also uploaded or to a central location at public health or the province, the flu injections or the COVID-19 boosters or original injections?
So just recently for COVID-19, a new vaccine was approved by Health Canada. So that is the XBB Moderna. So the Moderna brand was approved for that new vaccine. And so because of that change, the details about when the COVID vaccine will be available and just more specifications haven't been put out yet, but for flu, they are to come soon. And so we're hoping to provide people with both the COVID and flu shot together whenever possible if we have the vaccine here at the health unit.
Okay. So can you just go over the locations again for flu shots and COVID-19, just so people know there's more than one option?
Yes, so you can go to your healthcare provider to get your flu and COVID shot. You can also go to your local pharmacy. There's lots of pharmacies that will be providing both of those vaccinations, and public health will also be running clinics for those vaccines as well. So those are the three options, and we'll be posting, where and when clinics are. I know that pharmacies tend to be a really convenient location for a lot of people, so they don't have to drive around too much. But those are the three locations where you can get your COVID and flu vaccine.
In the past, the public health has had flu clinics where you can be vaccinated. Do you anticipate that may happen again this year?
Yes, so we're still working out the details of the flu and COVID clinics for public health. So we know that pharmacies are already administering both of those vaccines, and so are public health providers. So what public health will, healthcare providers. So what public health will do is we're trying to do a more targeted approach. So we cover the populations that maybe aren't able to get to a pharmacy or a healthcare provider. So we're trying to get our data together to see what populations don't have as much access and really targeting them to make sure that nobody's missed in the community.
In the past, I know that in the, for example, long-term care facilities, not sure in the retirement homes, but long-term care, they are given the injections if they agree.
Yes.
And I also know that in the past, vulnerable populations, like those who are unhoused, there has been a strategy for outreach. So those are the groups that you would really be working on to ensure that they have access to healthcare prevention as well.
Mm-hmm. So those who are in long-term care and retirement homes, we will be providing vaccine to those facilities because they would be the ones who are at the highest risk. So as soon as we get the vaccine, we'll be giving vaccine to them first so that they can vaccinate the residents who are there. And public health will then look at, as you said, those who are at high risk out in the community and target those populations and get them vaccinated and protected.
Yeah. We have just about a minute left in the program. Is there anything you really want to say before it's time to sign off?
I guess I just wanted to mention, if people want more information about any vaccines, some good places to get information would be the Grey Bruce Public Health website, as well as Immunization Canada. If you have specific questions, you can also call into the Vaccine Preventable Disease Team phone line or email us. That information can be found on our website, and a nurse is available to answer your questions. So whenever looking for vaccine information, any government website would be a good place to find accurate information, and nurses at Grey Bruce are available to answer specific questions if anyone has them.
Excellent. This has been so helpful and so informative. I want to thank you so much for being on the program to give us this update. I hope you'll come back and chat more about vaccines. Thank you to our viewing audience for joining us today to learn about programs, services, and resources available to you and to your family. Please join us again on HealthLink.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi, I'm David Sherman, host of Politically Speaking. Join me for my next show where my guest will be Ian Boddy, the mayor of Owen Sound. Politically Speaking on Rogers TV.
It's closing time, and you stayed out longer than you planned. So now you can't drive, and the buses have stopped running. You could always